everyone. Thank you so much for joining us today. It's a pleasure to have the opportunity to be here with you. I would like to thank our sponsors for hosting this series of very important presentations, the Administration for Community Living, Catholic Charities of Hawaii Kuike, and the Mediation Center of the Pacific. So just a little short piece about the Mediation Center of the Pacific. As Jody mentioned, I'm the executive director of the Mediation Center. It is a 501c3 nonprofit corporation. It has served Hawaii's community since 1979, so it was the first mediation organization in the state. We serve over 7,000 people annually. We provide mediation and dispute resolution services to address a broad array of issues, including the arena involving elders and people and their families with dementia and families caring for someone with dementia. So I want to start out with the premise, and I'm sure all of you know this, that caring for a family member with dementia is stressful. Stress can lead to conflict. Studies show that family conflict is generally a component of the caregiving experience. So you're not alone if you're a family member who's ended up in conflict. The challenge of conflict is it results in poor physical and mental health of the caregiver, reduced quality of care for the elder family member, and broken family relationships. And that's why mediation and family conferencing are such important processes for you to be aware of, because the failure to talk and discuss concerns and frustration is a recipe for conflict. So when you're not able to talk through the issues yourselves, it's important to be able to access these processes as early as possible. So mediation and family conferencing provide family members with the opportunity to safely engage in constructive conversations to support the person with dementia and their caregivers. What's important about these processes is it focuses on balancing independence with safety. And as caregivers, we know that's always a challenge. I know caring for my own parents, many times I wanted to just make decisions that I thought would protect them. And yet from their perspective, it wasn't giving them the independence that they wanted. So the focus in whether it's mediation or family conferencing focuses both on independence as well as safety. There's guiding values in both processes. It's respect. It's respect for the person with dementia, respect that they have their own ideas, their own values and what they are. Respect for the family culture and values. Every family is different. The way my family function is probably very different from the way your families function. And so it's not about trying to change a family's culture or value, but work within and be respectful of that. Self-determination, and that's empowering people to make their own decisions, and in particular, the person with dementia. They need to have a voice. They need to be heard. Their concerns, their values are critical in whether it's mediation, addressing specific conflicts, or a family conference and helping multiple family members come together to agree on a plan that will support the person with dementia. It's informed consent, and that means that family members and the person with dementia has the information they need to make good decisions. So part of the role of a mediator and a facilitator in a family conference is encouraging family members and the person with dementia to go out and access the many resources that are out there so that they can make good decisions and plans to support the person with dementia. Confidentiality. Mediation, and I'll talk more in detail about that, is a confidential process from the perspective that those communications can't be used if you do end up in a formal legal proceeding. But both mediation and family conferencing are confidential from the perspective that the mediator and the facilitator isn't going to go out and talk to other people about what those discussions were. They can't later be asked to represent one side or the other or support one side or the other. So it gives families and the people with dementia the security that they can have open, honest conversations, and that information isn't going to be used against them or shared with others. And last, and still equally important, is the mediator and the facilitators are impartial. And I'll be talking more about that. But as impartial people, we're not taking sides, we're not judging, we're not making decisions for you. We're helping you work through a process that enables you to have these very difficult and important discussions. So I want to start with the process of mediation. I think most people are familiar with mediation, maybe not as much with family conferencing. As I mentioned, mediation is a private process. And by that, I mean the mediator doesn't go out and talk to others about what we've heard. So if two family members participated in mediation, let's say two adult siblings participated in a mediation process, and one of the other siblings later called me and said, I want to know what was discussed, I wouldn't be able to share that information. Additionally, if the family or the participants in the mediation ended up in a formal legal proceeding, you couldn't subpoena me as the mediator, any records, and equally important, as I mentioned, those discussions in mediation, let's say you came close to reaching an agreement, but you changed your mind and you didn't reach an agreement, that can't be used later in a formal legal proceeding to say, well, in mediation, he was willing to do this and I want it now. It's off the table. And that's part of what makes mediation a really powerful process. I tell people you can bounce ideas off of me as a mediator, you can bounce ideas off of each other, you can come up with proposed resolutions, but unless you agree and it's memorialized in writing and signed by the parties involved, then it can't be used against you. Nobody can come back and try and get that agreement to be enforced because there wasn't an agreement. So it really encourages open discussion and brainstorming. Mediation, and I'll make a distinction between family conferencing, mediation only involves those people who are in the direct conflict. So you're not bringing in witnesses, you're not bringing in the entire family, just those people who are in the direct conflict to focus on those key issues that are in conflict. And I'll talk a little bit later about what those issues might look like. It enables those participants to listen to and understand each other's perspective. And the mediator assists with negotiation and agreements that meet everyone's needs. And I'll talk more about how that works. So in mediation, it's scheduled at a day and time that work for both parties who are involved in the mediation process. We bring people together, and I'll talk a little bit later about nowadays it being a little bit different because a lot of mediations are conducted by Zoom, but we still do have limited in-person mediation. So initially there's an opening. The mediator will ask each person to share what they would like to focus on in the mediation process. Then what's important is the mediator meets with each person privately. So while one person is in the waiting room, whether it's a physical waiting room or a virtual waiting room, the mediator meets with one person, and that way it creates a comfort level that the person meeting with the mediator can say whatever they want, and even they can say, they can vent, express their frustration and anger at the other person and not get the other person angry. And it helps them de-escalate some of those emotions. So the first part of the mediation as a mediator, we call it gathering information, fact-finding, because what we want to do is hear each person's story. I'm listening for how each person views the situation, and I'm listening deeper for what's important to each person, what's driving them, and what are the key issues that need to be focused and addressed. Once I gather that information by going back and forth in private session, I continue meeting with each person privately to then start working on what ideas each person has to resolve each issue. We do a lot of brainstorming. If they don't have enough information, we might end that mediation session so they can go out and gather more information. to come back and negotiate from an informed perspective. If they're able to reach agreements on some or all the issues, ideally we bring you back together and have the two people or however many are involved start discussing those issues and the agreements they've reached. If they agree, the mediator will help you memorialize that agreement and put it in writing and sign off on that agreement, which would be then the closing. If they don't reach an agreement, then there's still a closing talking about what was accomplished, some positive things that came out of the mediation process, and what their next steps are going to be to address those issues. And ideally, then they have a next step, or sometimes people want to think about it and come back to mediation later. So those are the key steps and how the process works. It sounds simple. It's hard work because it's you as individuals working through your emotions, the issues that have been in conflict with the assistance of the mediator. So I'm going to talk more about the mediator's role. I mentioned earlier, a mediator is impartial. And by that, I mean, I don't take sides. I don't judge. I don't determine who's right or wrong. I'm not going to tell you what to do. So that's what also makes mediation powerful is I'm not making decisions for you. What I am doing is listening to you in a way that you haven't been able to listen to each other, helping you understand each other's perspectives, identifying what additional information you might need to help you be more effective in reaching decisions, and then helping you brainstorm ideas, ideally creative ideas, to resolve the issue. Because it's not about who's right or wrong. It's about what decisions are going to work for both people, address your needs, and help you move forward. And I'll give more specifics in a little bit. So part of my job is being a listener. I ask lots of questions as a mediator. And why that's so important, and I remind people, you may feel like I'm asking questions about things that you've already talked about. But remember, I'm fresh ears. I'm hearing it from a completely different perspective. I'm hearing it for the first time. I don't know your background and your story. And sometimes by sharing your story to me as the mediator and how you view the situation, new information is going to come out. I'm going to hear it differently from the way you did. And that's going to help the two of you start listening to each other in a different way. And I just want to give you one short example. I want you to think about the last time you were in conflict with somebody, probably a long time ago. But I want you to picture the person that you're in conflict with in front of you, and they're talking. And what are you thinking about? Now, be honest. Generally, most people are going to say, well, I was thinking about what I was going to say when they stopped talking. And that's absolutely right. So people in conflict don't understand the other person's perspective, why they view the situation the way they do, what's making them so angry. And mediators hear that and listen to that. And I will tell you the secret to mediating is once you trust me as a mediator and you're sharing information, and I'm making sure I'm getting your story and what's important to you accurately, and I'm reflecting back, and I start sharing that with the other person, they really start hearing you through me. And that's part of the first part of mediation is getting those emotions down by having the mediator listen, telling your story to the mediator's listening to where there's some similarities, where are the differences, understanding each other's perspectives, and then moving to negotiating. That's also my job, is to help you negotiate. Now, negotiating may seem easy, but it's not always easy. And so listening to you in a different way and helping you negotiate by going back and forth, presenting different ideas, maybe presenting them in a way that's going to be help somebody be more open to that idea, as opposed to the person that you're in conflict with, can help people move forward. And as I mentioned earlier, if you're able to reach an agreement, I help you put that agreement in writing, in your own words and your own language. After you review it, if you're comfortable, then you sign that agreement. And then that becomes your agreement, what you're both going to live up to. Now, there's a lot of different issues you can address in mediation. So oftentimes we see adult siblings, they're in disagreement regarding the level of care needed or being provided for the person with dementia. So sometimes maybe the brother is the primary caregiver and is taking care of mom who's got dementia, and the sister or the other two, the sister and brother, feel mom needs additional care. Or maybe mom doesn't need as much care as you're providing and wants more independence. So those are issues that they can talk about together, particularly if they're entrenched in conflict. Before you include in a family conference, it's going to be focused solely on the person with dementia. So it's often really helpful if two siblings are really not getting along, or two people, maybe the caregiver and a family member aren't getting along, to try and work out their issues in mediation before going into the family conference. Oftentimes there's other underlying issues. You know, mom always liked you better. We never got along since we were kids. To talk about not how you're going to make each other like each other, but how are you going to get along to support the family member with dementia. That's going to be the focus. You may be in conflict about where the person with dementia should live. And I'm going to talk later about how the person with dementia fits into these discussions. It could be what activities are safe for a person with dementia during the pandemic. We've seen a lot more issues around the pandemic. Sometimes one value of a family member is, I think mom shouldn't be going out at all, shouldn't be interacting with anybody else because it's not safe, because you go to work, you might expose mom to the virus. So therefore, until this pandemic is over, you can't come over and visit mom anymore. And maybe the other family members are saying, no, that's crazy. We want to be able to spend time with mom and it's important to her. So coming in and focusing on those key issues about how you can make a plan work. Other issues, parents, one with dementia in disagreement with their adult children regarding whether the parent should move out of the family home, whether an adult child should move in with their parents, what activities are safe during the pandemic, and whether someone else should be working with that person. I'm going to be moving my screen here. So there's a lot of, these are not the only issues that can be addressed, but this is an example of some, and I'll give you some more examples. It could be two siblings, one's caring for mom and dad doing the physical care, they both have dementia. The other sibling is managing the finances. They get into a disagreement regarding whether the sibling handling the finances is doing a good job, whether that sibling is taking some of the money. And so they participate in a mediation process so that the sibling who isn't handling the finances can gain a better understanding of what the sibling who is handling it, how it works, what that person's doing, what additional information could be shared with the sibling who isn't handling it, so that they can reach an agreement and feel good about working together. So there's a lot of different issues. These are specific issues between individuals. It's not about the bigger picture of supporting the person with dementia. Who participates in the mediation? As I mentioned, and I reinforce this, it's the people directly involved with the dispute. So it could be parents, it could be adult children, the person with dementia, caregivers, guardians, attorneys. Now, one of the things that's important when we look at the person with dementia participating is what phase are they in with dementia. So if they're in the early phase and they're taking care of themselves, and suddenly the two adult children are trying to make decisions, they definitely need to be participating in that mediation process. Now, if they're in later stages of dementia, that doesn't mean they shouldn't participate. There's a lot of flexibility in the mediation process. So in some instances, we'll set up the mediation process at a time and place that's most comfortable for the person with dementia. So let's say they're at their best in the morning. So we're going to schedule that mediation process in the morning, and we will get their input in that first part of the mediation process on those key issues that their input is important on, such as where they're going to live, or whether the house should be sold, or whether they need somebody moving in and living with them. So they can provide their input. If they're comfortable and they have already designated somebody to be the person who's making decisions, whether it's healthcare decisions or financial decisions, and they're okay with those family members now meeting on their own once they've given input, then there could be a second phase of the mediation session where just those siblings or caregivers who have been deemed the decision makers by the parents can continue the discussion and make those decisions. But at the very least, the input of the person with dementia has been given on those issues. So again, there's a lot of flexibility in setting up the process to make sure that the person with dementia has input, has a say, whatever phase that they're at. So when is mediation appropriate? So if there is currently elder abuse, somebody's taking advantage of the person with dementia, whether it's physical, whether it's financial, mediation wouldn't be appropriate. Now, if the appropriate services, adult protective services have intervened, or a guardian, or a person who has been appointed by the elder, maybe a trustee or somebody who's been given the power of attorney, they could participate with the person with dementia, then it may still be appropriate. The participants need to want to work out their issues. Now, sometimes there's been siblings who've been at odds with each other probably most of their lives, and now they're in a position where they're taking care of it, generally a parent or maybe another loved one with dementia, and they need to work together, and it's really difficult. It doesn't mean they can't try mediation. It may be difficult if they are at such odds, they become very positioned and don't want to work out the situation. I still encourage them to participate because I think something productive can come out of it. The participants are willing to look to the future. Sometimes people are so stuck in the past about how they were treated or why they didn't get along that they can't move forward to focus on the current situations and the needs of the person with dementia, or move beyond their own self needs. Then mediation may not be appropriate. I do encourage people to participate in a mediation process just to see if they can work out their own issues, but it may mean that they need counseling or some other type of process to assist them. And the participants need to gather the information and resources to make informed decisions. So sometimes people don't want to go out and get the information that they need. It makes it really difficult to have a productive mediation process, because part of my responsibility is helping people reach informed decisions. I don't want you to make decisions based on emotion, because it's going to fall apart again later. How to schedule a mediation. So you can call 521-6767 between 8:30 a.m. and 4:30 p.m. and talk to a client service specialist. Now, what's important is you can provide them, give them some background on the situation. They'll help you decide whether it's appropriate or not for mediation, and work with you to decide who needs to participate in the mediation process. And then you can provide them with those people, that individual, or if there's multiple people's name and phone numbers. And then the client service specialist will call them, help them understand how mediation works, why mediation might be valuable, to see if they're agreeable to participate in mediation. So if you're really in conflict with someone and it's hard to talk with them, this is a great way to have somebody impartial outside contact them to talk to them about the benefits of participating in mediation. The client service specialist will then schedule mediation at a day and time that works for you and the other party. We schedule mediations at 9 in the morning and 1 in the afternoon, Monday through Friday. On occasion, we do have mediation options on Saturday mornings. This is not available every week. Mediations are generally conducted at our building, Haleopono, which is at 1301 Young Street. Currently, we also offer video conference, telephone, and off-site sessions are also available to accommodate the needs of the person with dementia or other family members. I make the caveat right now, because of the pandemic, majority of our mediations are being handled via video conference. And we do have limited in-person mediations at the Mediation Center of the Pacific building. It's also important to remember, if you want to participate in a mediation and you don't have the equipment, or maybe you don't have the bandwidth at your home or office, you can use the mediation room and the equipment at the Mediation Center of the Pacific. And so you'll be in a room by yourself with the equipment, so you can still participate remotely and safely, because you're able to social distance, and using our equipment with the support of our staff, you can still participate remotely. So that's another option to consider. So I'm going to move to the process of family conferencing. And family conferencing is a process that we created several years ago to assist families having to engage in challenging conversation, bringing all of the family members and other people who are involved in the life of the person with dementia to come up with plans that support them. So, you know, it takes a village, and that way everybody's involved, and that person with dementia has the love and the support that they need from everyone, because the last thing they need is people in conflict. So a family conference brings everyone together. It focuses on the values and needs of the person with dementia, and I'll talk more about how that works. It provides everyone involved with the person with dementia the opportunity to provide input. Oftentimes you see family members where one person is the primary caregiver. They're with the person with dementia every day or on a regular basis. So they're making a lot of decisions on their own, and other family members want to have input, they want to have support, and it may be they don't know how to do it, it may be that it's difficult to talk, it may be that the person who is the caregiver doesn't know how to ask for help, or the person with dementia doesn't want to upset the family and is going along. And so this opportunity really gives people the chance to come together in a safe environment and have really valuable, much deeper conversations. Unlike mediation, where we're not creating agendas, we're finding out key issues, and then we bring people together in that mediation process with private and joint sessions to focus on just those issues that are in conflict. With family conferencing, on the other hand, client service specialists will talk to every single person who each person thinks needs to participate. And I say it that way because generally we'll have one family member, or it could be the person with dementia, will contact us and say, I want to participate in a family conference. We'll say, who would you like to have in that conference? And generally they're going to say, oh, I want my spouse, I want my 3 adult kids. And then they provide us with the contact information. Then when we start contacting each of the kids, then they may say, well, my spouse should participate as well because they've been really involved with my dad, or my adult children also need to participate, or our niece is really, really close to dad, and I think that she should participate as well. So as we contact each person, we find out who they think needs to participate. We get agreement with everyone, so that's important. You just can't keep adding people in. There needs to be an agreement. And we find out from each person what their concerns are, what they see as key issues. And based on all that input, we start creating an agenda. Through these conversations, we also start learning about the culture of the family, so we can be sensitive to what's important to them, what their culture is, what's going to make them as comfortable as possible in this process. So during a family conference, generally we have a team of 2 facilitators, And one facilitator will take the lead, although they work together as a team. And the other facilitator is capturing key notes. So, and this doesn't happen in mediation. Remember, in mediation, it's about discussions. If there's an agreement, the mediator helps memorialize it. In a family conference, a facilitator is capturing key areas of agreements and key action steps that the family agrees to as they go through this discussion. Generally, it's on a flip chart. If it's in a Zoom family conference, we're capturing it on a shared screen, and all that information is provided to the family later as part of a family plan. So the facilitator is going to review the agenda, the issues that were identified by the various family members and participants prior to the family conference. And then they'll ask the family if they have a traditional way of starting family meetings. Some families start with a prayer, a pule. Some family members start with maybe the eldest family member saying a few words. So whatever their family tradition is, if they have a family tradition, we'll ask them to start the family conference in that way. So again, it's respecting the culture, the tradition of the family. Once we have that start, then we ask the family a question. And we want each person to answer, what makes this family unique? It could be just one word, it could be a couple words. And we go around and have each person who's participating share that. It gets captured on the flip chart or the whiteboard. The next question we ask is, identify the values of the person with dementia. So if the person with dementia is able to participate, and they can participate at all phases of dementia, which is really important. And even if they're not able to actively participate a lot, their input is always requested. So we're going to ask them first, what's important to you? What do you want your family to know that's important to you? And we'll capture that. In addition, or if they're not able to share that information, we ask each family member to share what they think is important to the person with dementia. And generally, it's going to go something like this. When we ask, what makes your family unique? People are going to say, you know, we're close, we got each other's back, we're strong, we love each other, we come together when we have problems, whatever it is. And then when we ask what the values of the person with dementia are and what's important to them, we generally hear things like, mom's really independent, she's a fighter, she doesn't want to make trouble, she loves us, she's our champion, and all the things that are the values of that person. Those also get captured. It's so important for the family conference because those two lists become the guidelines for the discussion and decision making later on. We then move to the agenda on each issue. And most agendas follow a similar format. It's often about medication management. It then might move to meals. How are meals prepared? Does a person with dementia have somebody to eat with? If they don't have somebody to eat with, do they not eat? Are they okay preparing their own food? Does somebody come by and drop off food? Is it time to have meals on wheels coming by? Personal care, dressing, feeding themselves, bathing, socialization. And so it generally works down a list, end of life desires and funeral plans. And so when families are comfortable with the process, they will start talking about and reaching agreements with the input from the person with dementia on all of these very important issues. And they agree on a plan. And as I mentioned, the facilitator is capturing these areas of agreement and action steps. And by action steps, I mean, maybe they're talking about mom is moving into a later phase of dementia. What's important to her is she's always wanted to be with family. She didn't want to move into assisted living. And so the discussion is about family members, being able to either move in to be with her or moving in with one of the other families. And maybe they need to gather more information before they make that decision. So the eldest son says, I'm going to go back and talk to my wife and family. I think we have a spare room that would work, and we would love to have mom come and stay with us so that you can remain with family. But I need to gather that information. So that would be captured in an action step. So at the end of the family conference, this gets memorialized. The facilitators will take it back, and the Mediation Center staff will turn it into a family plan that then gets sent out to every single family member. There's a lot of different issues to address, as I mentioned. I've already listed some of these, and of course, the other one that I didn't add is safety during the pandemic, which has been a key issue in many of the family conferences that we have handled and managed over the last several months. There could be other issues that are unique to your family. In some instances, we have seen mom is still in the mid stages of dementia, and so she has been going back and forth between living with her adult children, one on Neighbor Island and one on Oahu. But now she's having a hard time making the trip back and forth. And of course, now it's more challenging due to the pandemic. Clearly, this was an issue before the pandemic. And as the dementia is, as she's moving into later stages, the change is becoming more difficult for her to cope with. So the conversation is focusing on how can we support mom's need to be with all the family members and spend time with all of us, but not have this be so traumatic, this change of going back and forth. So there's a lot of different issues, and some of them may be unique to the family, but a lot of them will fall within these categories, or what needs to be changed in the house to make it safe for the person with dementia to be able to navigate independently in their own home. A lot of different issues to be addressed. Additional issues: financial decisions, healthcare decisions, end-of-life preferences, and funeral arrangements. I've mentioned these already. Now, I want to make the caveat that family members don't come together to decide who makes financial and healthcare decisions. These are decisions that are made by the person with dementia. Generally, they have a power of attorney, appointing one or more family member to make the healthcare decisions. Oftentimes it's somebody different who's going to make the financial decisions. Sometimes it's the same person. So if there are these documents in place already, the family can't come in a family conference and change that decision. Now, the person with dementia who's appointed that person working with an attorney can make a change. And that can be discussed in there, but it's not the family member coming in and deciding that for the person with dementia. It's their decision. Now, if they don't have that information in place and they're already in later stages and they've been deemed by their physician that they're not able to make those decisions anymore, then they're going to have to work with the attorney. And this was more Jim Peach's issues to make that decision. But we have had some families who don't agree with the person that's been appointed to make the financial or the healthcare decisions, and they want to participate in a family conference to change that, and they can't. So that was a legal decision made by the person with dementia, and the rest of the family can't change that. Now, if the person with dementia wants to have a conversation with other family members about why they made that decision and have a discussion, and they're able to do so, they can do that. So I'll give you an example. There, in one situation, very early on, a father had appointed his eldest child to handle financial affairs. In the early stages of dementia, this eldest child told his father, you know, I really don't want this responsibility. I don't think I'm very good at it. But the middle sibling is really good at this kind of thing. And so the father went to the attorney and made that decision, but wanted to participate in a family conference to have that discussion openly so that there were never conflicts between the two siblings about why that change was made. And the middle sibling, who was appointed, later appointed, and the older sibling taken off, they wanted to be part of that discussion to make sure there wasn't any bad feelings between them. So still, that person with dementia was making the decision, but they had that conversation in a family conference to make sure that everybody understood why those decisions were made, and to ensure that later on there wasn't going to be any conflict between the siblings. So a little bit different. When do you participate in a family conference? There's a lot of different reasons. The person with dementia wants their children and other family members to understand and respect their values and choices. And we really encourage people early on to, you know, bring their kids, invite their children to participate in a family conference so everyone understands what's important to them when they're able to really express that and talk about that. Maybe the person with dementia needs more assistance. They're moving into a later phase, or they have more needs, and there needs to be a discussion about that, not other people, other family members coming in and making decisions for them. Maybe the level of care required for the person with dementia is changing, or the primary caregiver needs help. It's becoming more difficult, and they really need more help. Maybe they need some respite. Maybe they need somebody to come in and help prepare the meals, and other family members are willing to discuss and do that. It could be the children of the person with dementia are concerned about the safety and care of the person with dementia. Family members of the person with dementia want to strengthen communication about care and support of the person with dementia. We see that a lot. The person who's the primary caregiver is so busy trying to support the person with dementia and take care of all the other facets of their life, that they're just making decisions and not communicating everything to other family members. And it's not that the other family members feel they're doing a bad job, but they just want to know. They want to know what the physician said when they went for that checkup. They want to know what other discussions have been going on, and maybe how they can help. And of course, when people live off island, even more so, strengthening communication is really valuable, which takes me to the next one. Sometimes people, family members who are off island, want to find a way to help, and they don't know how. So engaging in these conversations can be very valuable. Or maybe family members disagree with current care and the needs of the person with dementia. Oftentimes, the primary caregiver who's with the person with dementia day in and day out has a very different perspective of them than maybe another family member who sees them once a month, comes to visit, you know, twice a year. And so they don't see them as being, as having as many needs as the person that's there with them on a daily basis. So it's really helpful to have that discussion. Family plans should be updated as the stages of dementia change. And I want to make the caveat, some families go through a family conferencing process and they say, this is great. We're going to go home and we're going to make a commitment that we're going to meet every 6 months or once a year and do this on our own. Now that we've been through it, we know how to do it. And that's awesome. Other families tell us, you know, we are just so busy. We never take the time to do this. So we want to go through this process through the Mediation Center of the Pacific again in 6 months or 3 months or a year, whatever works for them, because it just helps us come together and focus, and we like that structure. So whether you do it on your own or whether you use the resources made available to you through the Mediation Center of the Pacific, it's important to revisit the plan, re-strengthen communication. Early stages, it could be just creating that family support system, identifying the strengths of the person with dementia and the family. Sometimes when somebody is diagnosed with dementia, people immediately think, oh, they need all kinds of help, but they're fine navigating on their own. Maybe they just need a little assistance. So talking about that and being proactive, so again, they can remain as independent as possible while remaining safe is important. Identifying concerns of family members so that it can be talked about. Identifying resources early on. Making sure early on that there is a power of attorney for making financial decisions, for making healthcare decisions later on, if that person with dementia isn't capable of making those decisions themselves. And creating an action plan of how are we going to discuss concerns if there is a conflict, how are we going to address it quickly so it doesn't escalate. Middle stages, again, looking at the strengths of the person with dementia. You always want to look at their strength. What can they do? What small changes can we make to continue helping them be as independent as possible? And what's important to them? What are current roles of family members? What other type of care is needed? Are there additional resources we need to start looking into now? In-home care, assisted living, how are those going to be financed? Who is the person who's making these decisions? Who needs to go out and gather this information, and having that action plan in place? And then in the late stages, making sure that everybody understands the recommendations of the physician, identifying resources. It may be 24-hour care, it may be skilled nursing at this point. Again, reviewing the financial plan. If the family home needs to be sold to pay for care, that even though other family members aren't making those decisions, but if they have concerns, if they don't agree, at least they can have a discussion about this, about why it's important to move forward. And again, making sure end-of-life desires, hospice, home, medication management are in place, and that the plan is honoring the values and desires of the person with dementia. How to schedule a family conference, again, contacting the Mediation Center of the Pacific between 8:30 a.m. and 4:30 p.m. at 521-6767. You can also go on the Mediation Center's website at mediatehawaii.org and input your information. It will get sent to the client service specialists and they will reach out to you. I also want to make note that there are mediation centers on every single island, and they also provide mediation. So if you live on a neighbor island, you can reach out to them. I apologize, I don't have their contact information in my slides, but I will make sure that that information is sent to you so that you have the name of the mediation center, the contact information for that center, so that you can reach out to them, because we're all independent, but we work closely together. So they do also have mediation services. Once you contact the Mediation Center regarding a family conference, the client service specialist, as I mentioned, will contact every person who needs to participate in that family conference. Now, sometimes some family members don't want to participate, and the question becomes, should we still have a family conference? If there's value and the other families want to, we encourage you to participate. If the person who has the power of attorney to make medical or financial decision does not want to participate, those issues cannot be discussed in the family conference, because the other members wouldn't have the power to make changes, but they could certainly discuss other issues. Client service specialists will create the agenda, and they will schedule the conference on a day and time that works for everyone. And also they can schedule the conference via in-person, via Zoom, or even by telephone. I want to go back to the poll. I was watching as you were completing that. So people with dementia should not participate in decision-making processes such as mediation or family conferencing. And I think I've emphasized it enough that they absolutely should be participating. And in fact, we will insist that they participate unless they're absolutely physically not able to participate any longer. But we have held family conferences and mediations in nursing homes who provided the family with a private room, and so the person with dementia was still able to participate to the extent that they could, as much as possible. In mediation, the mediator decides who's right and who's wrong to end the dispute. Mediators never make the decision, and that's the power of mediation. It's the people in the mediation who make the decision, and if they don't reach a decision, then the mediation is ended and they move forward to the next step of how they want to resolve the issue. Mediation is only used once a lawsuit is filed, and that's absolutely wrong. A lot of people associate mediation with a lawsuit, but we really encourage people to access mediation early. The discussions are going to be easier, and it can focus more on saving relationships in addition to resolving the immediate issues. Family conferencing process is designed to help families talk and agree on plans to support the needs of family members with dementia. And that's absolutely correct. And I think 100% of you answered it yes, so right on. And then the last one is through family conferencing, families can agree on who will make healthcare and financial decisions for a family member with dementia. And that is false. Remember, it's the person with dementia who determines who's going to have the power of attorney to make financial and healthcare decisions. Although it can be part of a discussion in a family conference so other family members understand why that decision was made. In closing, family conferencing and mediation can preserve family relationships. This is so critical. It's not going to fix long-term problems between siblings, but it can help them look and understand these issues and work together to support the needs of the family member with dementia, which is so important. They need family members supporting them and not fighting. It can maintain the dignity of the older person and the person with dementia because it gives them input. It helps the family focus on what's important to them. It clarifies the real issues and interests. Oftentimes, it's not about the people. It's not about how you treated me as a kid growing up. It's about, I'm afraid of losing you. I'm afraid of going through these stages of dementia and having these hard conversations. It enhances family communication. It helps families develop plans and shared decision-making to support the person with dementia, and incorporates outside professionals getting the resources you need to make informed decisions. And equally important, it helps families gain an appreciation of each other's perspective, which is so very important to be able to work together and support one another. And with that, I would like to say mahalo for participating. And I know we're going to be opening it up to questions through the question feature.